Hi, good afternoon everyone. So today we'll be discussing about fetal skull. So this is a fetal skull, and talking about the bones on fetal skull, we have two frontal bones over here, two parietal bones, one occipital bone and two temporal bones. So these are the temporal bones. So total there are seven bones which form the fetal skull. The fetal skull is mainly divided into three parts, that is the vertex, the brow, and the occiput. So, vertex is the most commonly asked part. Where exactly is the vertex? So, if we talk about vertex, it is a quadrangular area. So, it is a quadrangular area. This is the vertex, which is bounded entirely by the anterior fontanelle and the coronal sutures, posteriorly by the lambdoid, posterior fontanelle and the lambdoid sutures. So this is the posterior fontanelle and these are the lambdoid sutures. This is the anterior fontanelle, or it is also known as bregma, and these are the coronal sutures. And laterally it is bounded by imaginary line which passes through the parietal eminences. So these are the parietal bones, these are the eminences of the parietal bone. So imaginary line passing through the parietal eminences and anteriorly by the bregma and the coronal sutures, and posteriorly by the posterior fontanelle and the lambdoid suture. So this quadrangular area, it is known as vertex. This is important question which is asked in the exam. Thereafter, sutures. They ask about sutures. So, talking about the sutures, these are the non-ossified membranes which bound the two bones of the fetal skull. So, talking about the sutures, so there are two main sutures if we talk about. This is the sagittal sutures. That is the suture which is present between the two parietal bone is the sagittal. This is the sagittal suture. And this is the coronal suture, that is the suture between frontal bones in the front and parietal bones at the back. So this forms the coronal sutures. Now, talking about this suture between the two frontal bones is the frontal suture, and the suture which is present between the parietal bones in the front and occiput bone at the back, these are the lambdoid suture. So these sutures are important. You should be knowing what is the importance of sutures. This is another important question which they ask in exam. So talking about what is the importance of sutures, they assist gliding movement of one bone over the other because they are non-ossified. So the skull bones can easily glide over one another, and during the process of molding when the head is passing through the pelvis. So one advantage is this. Secondly, we can palpate the sagittal sutures and we can know the degree of internal rotation of the fetal head when it is passing through the pelvis. So now, apart from the sutures, there are two fontanelles. What are fontanelles now? These are wide gaps between the these in the suture line. So these wide gaps are known as fontanelles. So mainly there are six fontanelle, but in obstetric, if we talk about their importance in obstetrics. So two fontanelles are important. Interior fontanelle, this is the interior fontanelle, and this is the posterior fontanelle. Interior fontanelle is diamond in shape. You can see over there. So it is diamond in shape. Its anterior, posterior, and transverse diameter is 3 centimeter, and this gets ossified by around 18 months, 1.5 year. So it is considered to be pathological if it doesn't get ossified by 2 years. So then it is considered pathological. What is its importance now? This allows the growth of the fetal brain. So fetal brain almost becomes, the baby's brain almost becomes double in size by 2 years of age. So it allows the brain to grow. Secondly, during the pregnancy, we can just palpate this interior fontanelle and we can know the degree of internal rotation or the degree of flexion of the fetal head. Then through this interior fontanelle, if in the baby it is suppressed or it is sunken, it means that the baby is dehydrated. If it is protruding upwards, it means that the intracranial pressure is high. So it is used to know the intracranial pressure of the fetal brain. Thereafter, it can be used for collection of the blood sample and for exchange transfusion also it can be used. So these are some of the advantages of this anterior fontanelle. Posterior fontanelle, as compared to anterior fontanelle, it is smaller and it is triangular in shape, and this ossifies by 6 to 8 weeks. So this is the difference between these two. Thereafter, you should be knowing what is Caput succedaneum cephalhematoma. So that will be covering in our next video. So talking about fetal skull, these are some of the important points which you should remember. Thank you.